Do you want to look refreshed and rejuvenated without surgery? Injectable fillers and neuromodulators can eliminate the appearance of fine lines and wrinkles and restore lost volume in the face. Dr. Kristen Kent is from Holcomb Crathen Plastic Surgery and Med Spa, and he's here to tell us more about injectables and these neuromodulators. Good to have you here, Dr. Kent.
It's great to be here, Cindy. I really appreciate it.
So what would be the most popular injectable that people are getting?
Well, I would say that that's probably a tie between the neuromodulator Botox and then the other most popular, I think, injectable filler would be Juvederm, which is not a neuromodulator but a filler. It fills things up where the neuromodulators take away overactive muscle activity.
Okay, yeah, let's talk a little bit about the difference, because I know there are people out there who hear injectable and all they think of is Botox. Quite a difference.
Absolutely. They do entirely different things, and they're advertised widely, so we get the idea sometimes that Botox does everything, because Botox is probably the best known of the term for a filler. But Botox takes away an overactive frown line, an overactive make you look tired because you have heaviness between your brows, or takes away squint lines and smile lines that are overactive. When we're younger, we smile, we don't get a lot of lines, but when we aren't as young as we used to be, then we start getting lots of lines that give away a sort of an idea that we're not as young as we used to be.
Well, let's take a look at a before and after, just to give you an example of what we're talking about here. The woman on the left, you can see those little lines right between her eyebrows.
Absolutely. She's probably about 51 or 52, and she called those her 11 lines. And she said that she didn't have those a few years back, and when she didn't have them, she thought she looked more like she expected to see when she looked in the mirror, even now, because she felt as young as she did 10 years ago, but she didn't look as young as she did. And so we just put a few drops of the Botox between the eyebrows, and within a few days, you can see on the right-hand side, she's trying to make that frown, she's trying to look angry, and she can't.
She can't. But you can still have expression. That's the thing. Yeah,
I think anything in plastic surgery, anything that we all hear about or know about that's overdone, like kind of anything in life that's overdone, is a bad thing.
Sure.
And so we want to take away the overactive expressions. I will say that I've never had anyone say, leave me a little ability to frown or to look mad or angry.
Right.
On the other hand, with the smiles, we're just trying to soften the smile. We're not trying to take away the ability to smile, because that looks unnatural.
It certainly does. Now we have another before and after to take a look at, and you're going to explain for us what we're looking at here.
With this lady, a little bit younger, and we have a little bit of an issue with cropping just a little bit of the corners, but she has very, very deep and active lines all the way almost from her lower part of her eyebrow down to her mid-cheek.
The crow's feet area.
The crow's feet. And, you know, when we live here in Florida, we do a lot of squinting.
Yes.
With the bright sunshine, and so we develop these very deep. And so we put some Botox in the two areas, some neuromodulator at the corners of the eyes, and now when she smiles, she has a few lines, and she looks natural and normal, but it doesn't bunch up and look unnatural. It doesn't look aged.
Right, exactly.
The things we don't want to see.
It's softer.
It's softer.
I want to get to the last before and after. Quickly, tell us what you've done here.
And here's a lady probably in her mid-30s, and I believe she exercised a lot, she ate healthy, and the fold between her nose and her mouth became quite deep early. And she said, you know, if I had this fold when I was 50, it might not be so bad. Now, most people when they get to 50 don't like that fold any more than they did when they were 35. But in her case, it was a premature look of aging, and so we just filled that line out. And on the right-hand side, 2 years later, we told her, you know, it's past time to refill, because when they tell you it's supposed to go away, but you can see it's still excellent.
It's excellent, and the results were immediate. Doctor, thank you very much for coming and explaining all this to us. To take advantage of Dr. Kent's specials on Botox and fillers, go to tampa-med.com or sarasota-med.com. Dr. Kent, thank you again.
Thank you, Cindy.
We'll be right back.